CDC Director Dr. Rochelle Walensky joins us now to discuss the new mask guidance. Good morning to you, Dr. Walensky.
Good morning, Gayle. Thanks for having me.
We're glad you're here. You got a lot to sort through for us today. We just heard in David's piece a mother thanking the CDC for more definitive guidance about wearing masks. Still, others are saying, what are you doing, CDC? You're confusing all of us. Can you just explain, when you change the rules, it seems to me, when you get new information and you get new updated information? Is that what has happened here?
That's exactly right. So where we were in May is we had a country that had mostly alpha variant of this virus. Only 1% of the sequenced virus was Delta at the time. Here we are about 10 weeks later, and most of what we're sequencing now is Delta variant, and Delta is just a different kind of beast, as we say. You know, it is much more contagious. We knew that already. The thing that's important, and that is new data that we've seen just in the last several days, but corroborated several times, is that if you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
It's new, but it's also very scary because you used to think if you're vaccinated, you're safe. Isn't it true that if more people had gotten the vaccine, we wouldn't even be dealing with the Delta variant right now?
You know, I think it's very true to see that the country that has so much disease right now, 80% of our counties with the highest amount of disease have the lowest amount of vaccination in this country, less than 40% of the people vaccinated. So there is no doubt that the reason that we have so much disease right now is because it has gone after those who are unprotected, unvaccinated. And the vast majority of transmission that is happening in this country is happening among unvaccinated people.
Dr. Walensky, where do you see this trend going in terms of infections as we head towards the fall? Tom Frieden was here, one of your predecessors at the CDC yesterday, and he said we could have 200,000 infections daily by the fall. And do you see us having to actually up mask guidance even further from this point?
We will follow the science, and we'll have the science lead the recommendations that we make. I certainly hope we don't have to be in that situation. But what I can tell you is this: we can halt the chain of transmission. We can do something if we unify together, if we get people vaccinated who are not yet vaccinated, if we mask in the interim. We can halt this in just a matter of a couple of weeks.
Dr. Walensky, the CDC also recommends that everyone in schools wear masks. But when you look at the data, 1.3 to 3.6 children have been hospitalized because of COVID, 0.26 deaths when it comes to children. So when you hear parents say, why do I need to wear or have my child wear a mask, can you explain that?
Yeah, several important things. First of all, we want kids back in school. We want school to be full-time in person. We want children to be able to enjoy the school year. We've seen outbreaks this summer of schools, summer schools that have not been complying with the guidance, and we know that when you have a lot of disease around, it comes in from the community, and then it can spread in schools if you don't do what is necessary. We also know we don't have vaccines available yet for children on 11 and younger, and our children who are 12 to 17, only about 30% of them so far going into the school year have been vaccinated. So we know that the majority of children who are entering the school year will not be vaccinated. I know people are saying that that children do better, and they do, than adults, older adults, with this virus. They tend to be more asymptomatic. They tend to have fewer symptoms. But I do want to emphasize that if you compare COVID deaths to children this year compared to flu deaths in prior years, it's about twofold more. So it is really important to understand that while children are not getting sick nearly at the rate as adults are, they're getting sick more than they would during a standard flu season, and more deaths indeed.
President Biden is expected to announce today or very soon that he wants all federal workers to get the vaccine. Are you hoping that private companies, I know it's their decision, but are you hoping that private companies will follow suit?
I am hoping that we will do everything to unify as a country to get more and more people vaccinated. And if that's one strategy in our toolbox, I'd be all for it.
Thank you very much, Dr. Rochelle Walensky. We appreciate your time.
Thanks so much.